So then when we cross the threshold of chronic pain, what is it that is resulting in that chronic pain? What's the process that the body goes through when it feels pain?
Because of technology and media, we just want the online answer. The Instagram video that says this.
Welcome to the show, everyone. I am here with my boy, my physical therapist, Shayan. Sean, will you just go ahead and tell everybody a little bit about yourself and what you do and how you saved my life?
Oh, well. Wow, how much time do you have? No, I'm just kidding.
30 minutes.
Oh, dang. All right.
All right.
No, I'm just kidding. I'm Dr. Shayan Safar. I'm a doctor of physical therapy, board-certified orthopedic clinical specialist. I'm also a stuntman and a recent jiu-jitsu black belt.
I know, man. Congrats on that.
Thanks,
again.
man. Appreciate it.
You know, left-handed shake.
Yes.
We hold this though right.
How I saved your life? Man, I didn't really do much. Cameron is a specimen and
Not
puts up
quite.
some pretty significant weight. So
I'm
we
blushing
just
and trembling.
his butt's trembling right now. But we just did some tests and found some little building blocks that you can improve on so that you could put up that weight. And I think you had some experience with physical therapy in the past, but just like all the medical professions, things have changed a lot. And I think you were doing a pretty extensive warm-up that was like a lot of static stretching and stuff like that. And we kind of found some building blocks and just tweaked some things. And then now you're sort of off to the races, lifting really heavy stuff.
Yeah, it's my experience with you has been really interesting because I've worked with physical therapists for as long as I've been training. So that's about 15 years now. And I will recommend people that I like, and I've liked, a handful of people in my career and like working with physical therapists and stuff as well. But yours was so different from the people that I've worked with before. Your approach was, and I think in the beginning you said like a sniper, right? Compared to a shotgun approach that a lot of physical therapists take, where they're kind of like, okay, you've got this symptom, we're going to blast you with a lot of different things and hope something works. When I met with you for the first time, you were very precise in what you were doing. Is that just because of the clinical orthopedic training that you've had, or what would you kind of equate that to?
Yeah, so the residency that I did, which for medical doctors, residency's pretty much mandatory, but for physical therapy, I think the stats are like maybe 5 to 10% of physical therapists do different kinds of residency, and then so orthopedics is one subsection of that. That was sort of the motto in residency, like you're trading in your shotgun for a sniper, because the environment we were at, we didn't have aides, we didn't have long appointment sessions, so the whole idea was that you would run a bunch of tests at the beginning instead of just giving kind of like a cookie cutter approach and doing a 2-hour session with your patient where they're with an aide in the background and whatever. Instead, you're doing a bunch of tests to really hone in on what's the most important thing.
Okay.
And I really appreciated that because I think if you went to your doctor and you said, hey, I'm tired, and they just gave you a blanket prescription of a bunch of medications, you'd probably either not listen to them or be a little concerned, right? Instead, you'd want them to run a bunch of tests. Hey, blood work, imaging if they needed, and then based on that say, okay, hey, Cameron, we found this one little vitamin or this one problem is just lacking. Let's do the smallest thing that we can do to create the biggest change, right? And that's when people have really good, success stories and stuff like that. And it should be the same with PT. I think a lot of times people have an expectation that, hey, I just have knee pain. What's your knee pain program? And I'm like, doesn't really work that way because as we've talked about, pain is very multifaceted and some of the factors are psychological, not even just physical. And so the whole approach should be, let's get a bunch of tests going and really hone in like a sniper and find the 1 or 2 missing pieces that you need.
Yeah. So I want to zoom in on pain a little bit. I know that we could go into just an extensive conversation about pain, all the different things that relate to it, but if we looked at a 10,000-foot view of what pain is and how people experience it, would you be able to describe to people like, when you have a symptom, this is somewhat of what you're feeling, and then how would you go and address that? Like, can you take me? I know it's, there's a broader context to that, but could you take me through just like a little bit of your thought process of how you meet with somebody and then go, okay, hey, this is how I'm going to attack your symptom?
Totally. So pain is, like I said, a very multifaceted thing, and it has psychological factors and all that stuff. The best definition I've heard of it, now this isn't like the textbook definition, but one of my mentors said pain is your risk thermometer, right? Okay. So when your mind and body is approaching a certain level of risk, your body sends a pain signal to basically say, hey, Cameron, this is scary. We want to protect you and make sure you don't cross this line, right? For instance, if I pinch your hand, like really squeeze on it, your brain's going to say, ow, ow, ow. And then as soon as I let go, you'll be fine. I didn't do any tissue damage, but the pain was coming there to warn you, right?
Yeah.
Now, sometimes people cross that line. Just things happen. They don't even have time to stop it, right? You know, get into an accident or injury. Someone clips you on the field. You don't have the warning signal. You just unfortunately had tissue damage. So my job is to basically run a bunch of tests, ask questions to sort of understand what's going on, to see if I can pinpoint the mechanical reason for why you're having pain, right? Along that journey, I might discover some psychological stuff too that we're going to address. But that's sort of it. I have to break down this whole complicated sort of symphony of what's going on and analyze what are those little variables that's contributing to it.
Got it.
Right. So, for instance, you might have back pain, and I have to deconstruct, okay, when are you having this pain? What's causing it? Okay, so it's happening every time you squat. And then we realize that hypothetically you have a stiff hip. And because of this, every time you squat, because your hip is stiff, now you're rotating too much at your back and you're pulling in your back too much. And then so I have to deconstruct that, because a lot of people, including myself, sometimes when things just really hurt, you don't have the presence of mind to sort of sift through all that information and decode it. You just go, my back hurts.
Yeah.
And the scary thing, unfortunately, for a lot of people is when they get mismanaged in the medical field, it goes from my back hurts to I have a bad back.
Yes.
Which isn't necessarily true, right? Like, we all feel pain. Pain is a normal and healthy part of life. It's supposed to be there to tell you not to touch the hot stove, right? But unfortunately, sometimes when people get mismanaged, they now have identified with that pain, like you've talked about. And it's no longer I'm experiencing pain, it's I am pain. Like, I have a bad back, I have a bad knee, and it's no longer my knee's irritated, or, you know, I have a weak glute, and because of that, if I do too much workout, it flares up. My knee is bad. So we have to kind of decode these things and really discuss it.
Okay. So then when we cross the threshold of chronic pain, and that kind of gets to that area for people where now they identify with their pain, it becomes chronic. It's lasted, I think correct me if I'm wrong, it's like past 3 months maybe.
Yeah, 3 or 6 months depending on.
So 3 or 6 months, it becomes chronic. What is it that is resulting in that chronic pain? I mean, it's not, I don't want to simplify it in a way where it's such as like, you know, maybe in a certain circumstances, like you have a mobility problem or if you have this, but why does that signal continue to get sent to the brain to go like, hey, there's a level of risk here and it's not going away?
Yeah. So there's an interesting phenomenon that actually happens where the nervous system gets more attuned to the pain. So like that risk thermometer becomes more sensitive, or it takes less to trigger the alarms, the pain, right? So for instance, if there's a fire happening in the area, the alarm's going to hit, the sprinkler is going to go off, right? Now, if fires are happening more frequently, it would be smart to make those sprinkler systems more sensitive to catch it sooner so the fire doesn't get bad.
Okay.
When people have chronic pain, that's essentially what their brain is doing. It's saying, hey, there's this risk thermometer, and I keep sending you pain signals to say, hey, something's going on, something's going on, something's going on. But if it's going to keep happening, I'm going to make it happen sooner so that you stop yourself, because your brain is trying to protect itself, right? However, that might not always be the best approach, right? Meaning your brain is trying to do it to protect you, but do you actually need to be protected? And that's where psychology and certain things come into play, right?
Yeah.
There are physical changes that happen in the brain with chronic pain. It's not purely psychological. Your nervous system does get more sensitive to it. So when we're treating it, not only do we have to address the biomechanical side of it, but we also have to appreciate that it's going to take a little bit longer, because your brain is a little bit more sensitive to these pain signals that are coming at you. And because of that, we have to factor that in sort of the rehab.
Yeah. It's interesting because I feel like people, their expectation when they come to a physical therapist like yourself or any other one, chiropractor, whatever it is, it's, I may have been dealing with this pain for X amount of time, months, years, whatever, and they kind of want it to be done now, but they don't understand the psychological work that needs to take place in order to fix that pain, or the, you know, the additional work that it takes. You know, we have a system that has been more sensitized and is needing to go through a process to desensitize that area and then go, okay, now that, you know, we're doing better, we can move on and downregulate that pain sensitivity and get into a more comfortable state. Is there anything that you could add to that, like with people's expectations for pain? Because people will go into, I need to take Advil or something like that. And when we were doing treatment, you had talked about something that I thought was super interesting is, you know what, actually, I'm going to pause on that. We'll come back to the Advil thing in a second. What are the kind of the steps? What's the process that the body goes through when it feels pain? Because there's an inflammatory response. There is all sorts of things. How does the body go through its response in dealing with pain?
So there doesn't have to be an inflammatory response.
Okay.
So now in PT we say there's no actually pain nerve. What we call is nociception, and nociception is sort of like the word that we're using to substitute pain. But essentially your body has a pressure, a temperature, or a chemical receptor.
Okay.
You reach a certain level of pressure, you reach a certain temperature, burning, or you reach a chemical like, acid or something, and then that signal goes up to your brain. Your brain interprets it and says, is this scary or is this okay? And then comes back with a pain signal. So for instance, temperature. Okay. If you go into a sauna, it might feel really good. And, your body's sensing temperature, takes it to the brain. The brain goes, hey, I'm in a sauna. It's warm. It's okay. We're good. And it feels relaxed, right? But if you touch a hot stove, you're getting a really intense spike in temperature. Your temperature signals are, those nerves are going to the brain. They're saying this is a lot. And then your brain goes, I don't like that. That's scary. Withdraw the hand. You feel pain. You feel burning, stuff like that. So there's no like pain receptor, right? It's your brain responding to pressure, temperature, chemicals, and then interpreting it and going, is this scary? Is this safe? And then it elicits a pain signal to you to basically say, with fight or flight. Should you withdraw your hand? Should you stay there because it's safe? Or whatever action you need to do.
Okay.
It doesn't have to have an inflammatory process, right? Because, for instance, some of these pain things are like a reflex, like, hey, just to quickly withdraw. You might not have done any tissue damage. There might not have any inflammation taken place, but your brain send a quick signal to you to just take action, right? So it's not so clean cut that when you experience pain, this thing is physically happening in the body. We're not 100% sure, and everybody's case is different. Because in some cases, you had a physical stress. You tore your ACL, and then after that, you feel the pain, right? Because it happens so quick, and then your body's feeling pressure in the knee because the swelling's coming, and now it's saying, oh, I feel pressure, goes to the brain goes, this is scary, and, goes from there and makes a pain signal.
Yeah.
Yeah.
So then in a scenario where if somebody bent over and all of a sudden they felt like that shock, right? Is that just the body trying to go into like a protective state? And then they notice that now like my back is stiff and it's stiff for an extended period of time. Is that just more of that like protective response of risk management that the brain is trying to assess and go like, hey, this hurts. Let's limit this range of motion to keep you safe.
It can be a lot of times, right? One of the interesting things about pain in people's body is everyone has a different context, a different story, a different body. So it's always hard to do a one size fits all. Like, hey, it's your body's trying to protect yourself. Hey, your body's not trying to protect yourself, right? Everybody's sort of different. A lot of times the pain signals are your body's way of trying to protect itself, but it's not 100%, right?
Okay.
Nothing in medicine is ever 100%.
Yeah.
Right? Everyone has a different body, different context, different goals. And that's where having someone look at these things for you and decoding it, I think is so valuable.
Okay.
Right? Unfortunately, we live in a society now where we want these sound bites that are absolute. If you do this thing, your pain will go away. Your pain is caused by this.
Yeah.
That's not the case, right? Everything is so context dependent. Sometimes you bend forward and you overstretch, and because that your body spasms because it's trying to protect itself. Sometimes your body spasms because it's just, it had not enough electrolytes, right? So it's not protective. It's just literally not having enough electrolytes, and now those muscles are just grabbing.
Yeah.
So everything is sort of dependent on what's going on.
You said earlier that pain it's not a bad thing.
Yeah.
It is your body's trying to send you a signal. Why do you think that our immediate reaction when we sense something that is painful, whether that is knee pain, hip pain, whatever it is. I deal with this on a daily basis, right? Someone will come in, hey, I felt a pop and it hurt, and then why is it that we try to remedy that issue? And when is it important for us to go, oh, this is a bad thing that needs to be treated? Like, how can we identify between, is this something that is really bad, or is this something that we can manage for right now?
So one of the interesting things I always talk to my clients about is there's discomfort and then there's danger, right?
Okay.
And I think a lot of times that's where the evaluation is so crucial, right? Because when there's discomfort, a lot of people are fine with that. Like you can sit in a uncomfortable position for a little bit, like a little bit of discomfort, a lot of people are okay with it. It's the possibility of danger that I think worries a lot of people. And until we sort of evaluate it and know what's going on, I think that's the big thing. Unfortunately, there's no clean cut way I can say like, hey, it's going to be danger if this is happening and it's discomfort if this is happening. Again, that's kind of part of what we have to do, like in our job, is do the evaluation and say, hey, is this discomfort or danger? I think when it's a lot of times when we answer that question, the anxiety and the fear around the pain diminishes, and oftentimes it's enough for people just to say like, hey, I just wanted to see if my knee's hurting because it's just hurting, or is it like I tore something and I need to get surgery because of it.
I feel like we are often just trying to remedy or numb, let's say, whatever that could be.
Yeah.
And I think it's important for people to understand, when do you need to remedy it? When do you like, is Advil, like we were talking earlier about ice and stuff, right?
Yeah.
When is it necessary? And you said it's context dependent.
Yeah.
But how does somebody figure out this is an issue that needs to be treated immediately, or this is something that, maybe will go away, or, you could do a simple mobility exercise or something like that? Like, how can a person at home identify when it is discomfort, when it's danger?
The best answer I can give you, go see an expert.
I mean,
no, but here's the thing, and here's why. You can have discomfort that's appendicitis and is life-threatening, or you can have discomfort that's an abdominal muscle spasming. Until I see you on the table or I ask questions, I can't tell you. You know what I mean? And unfortunately, I think that's one of the issues we're facing today, is because of technology and media, we just want the online answer, right? But
the Google MD type of thing.
The Google MD thing, the Instagram video that says this, it doesn't exist.
Yeah.
Maybe sometimes you'll get lucky because you're finding the internet and they're throwing a dart and that dart happens to land the bullseye of your thing. But in some cases, you're actually just playing roulette, right? Because you could be having shoulder pain. Shoulder pain can be coming as a symptom of a heart attack, right?
Okay.
So I can't even tell you it is until I ask questions, until I take your blood pressure, until I rule out other things. So at home, to know whether it's danger or discomfort, I haven't found a way for people to quickly sift through that and rule it out themselves. An overall theme is that if it's elicited by movement, meaning it hurts when I move, and then when I don't do that movement, it doesn't hurt, is usually a good sign that it's something mechanical, right? Meaning like my knee hurts when I move it, but if I don't move it, it doesn't hurt, is generally, this is not 100%, a sign that, hey, it's just a mechanical stress, some tissue that's irritated. Again, not 100% rule, because you could have a knee fracture and you found a stable position and it doesn't hurt when you're not moving it, but as soon as you move it, the bones are grinding on each other. And that's probably more dangerous thing that you should go get stabilized and stuff like that.
Yeah.
So it's hard. I mean, we live in an age where we want home convenient online answers, things like that.
Yeah.
But I don't think we're there yet with medicine. Unfortunately, I don't think we'll ever get there with medicine, because some of these things are emergencies and the body is so funky in the way it shows things.
Yeah.
I always tell people this: seeing a PT is sort of like seeing a financial advisor.
Okay.
There's general principles we all know about finances, just like there's general principles we all know about fitness, right? Like you should save money, you should work out. You should eat healthy, you shouldn't spend too much. Like these are sort of the same parallels, right? But when it comes to how do I get out of debt, or how do I get out of pain, or how do I become rich, or how do I become more athletic, it's good to talk to an expert who can look at your context and say, hey, this is what you're working with. This is what you want. This is what we know about ways to get there.
Mm-hmm.
It's sort of the same with a financial advisor versus a PT. And I think it's interesting because if somebody said on Instagram or whatever, hey, invest in this one thing and you'll be rich tomorrow, you would be like, you're a snake oil salesman and I'm not listening to you. But somehow when it's in the context of health and wellness, like, do this one exercise and you're going to be the fittest thing ever, we're like, all right, cool, I'll try it. But it's like, but you don't know if that's right for you. You might already be amazing at that exercise. You might not be able to do it because you're lacking some building blocks. So it's like, it's one of those funny things that I think we're always looking for the quick fix. Talk to an expert. Have them give you the plan on how to have their best journey.
But it seems like people are so hesitant to go and talk to an expert. And I think with the medical system, the way that it is right now is if I have discomfort or pain, I need to go to a doctor. That doctor needs to evaluate me. Then they need to give me a prescription. Then they need to go here and here and here and whatever, and it's like, is it like a delayed, is it because there's a financial incentive, there's time incentive, there's all these things that delay people from doing it? And then maybe because they find this thing on Instagram that says, I'll fix this. And, do you have tight hips? Well, maybe it's causing your lower back pain. And then they just want to go and do this thing that they saw on Instagram. Do you think it's just that's the reason why they try to bypass the process to see an expert?
Yeah, totally.
I think that's one of the things I really value about your approach is I don't need to go through that process.
Correct.
I come to you and I go, hey, like, I'm hurting and I don't want to be hurting anymore. And you do your evaluation and stuff. There's a premium that comes with that, but it has, for me at least, it's been so beneficial because I don't have to go through all that other stuff, and
Correct.
then I can feel better now. I just want to know I don't know. There's probably no answer to this question, but I would like for us to get to a point where, if we're feeling some sort of pain, discomfort, or whatever that may be, we can trust in like an expert like yourself and then go into that whole.
Correct. So you brought up a really good point, which is a lot of people are frustrated because if your back hurts that day, you have to then go see a doctor, right? And either you go see your family practice doctor who probably is on a wait list for a month for the next appointment, or you go to an urgent care where you have to wait there for 3 hours and you're not exactly sure the quality of care you're going to get.
Yeah.
And then you have to rely on what they're going to say, whether they'll prescribe you a PT sort of prescription or they'll, give you meds, which you might not want to take because you're like, it's not that bad.
Yeah.
Or who knows, they're going to say, let's do a surgery that might be unnecessary. Right.
Mm-hmm.
And then the insurance company has to improve that if, let's say, they even prescribe PT, which is what you wanted. And then you have to find something that matches your insurance. And then you have to call them, and it's got to be like 4 weeks out. Right.
Yeah.
So you're like, why am I going to start this whole process? Because in 2 months, by the time I can see the PT I want to see, I might not even have this thing. Right. So let's see what's on Instagram. I agree with you. That's the frustration. That's why myself and a lot of PTs are moving away from the insurance model. Because about 10, 12 years ago, we got something called direct access, which means legally you can come see me before you see your doctor.
It wasn't like that before?
It wasn't like that before.
Okay, interesting.
We're basically now we're part of the primary care team, meaning you can come to us first, and then if we see anything that's suspicious, like you come to me and say, hey, my back hurts, and in my questioning and in my test, I go, this doesn't look like just regular back pain. This looks like a fracture. It looks like cancer. It looks like something else. I have that knowledge to know that, hey, you should go to the doctor. You should go to the hospital. It's part of our job, right? So the issue is that although as PTs we're able to do that, the insurance companies still haven't really adopted that model yet. They want you to go to the doctor first. The doctor has to prescribe you physical therapy. Then you go to the physical therapist. And for a lot of people, it's really frustrating if you just hurt your back that day.
Yeah.
Since I'm not taking insurance, I can see you that day. And if there's anything that seems funny, I'm going to tell you, like, hey, man, this probably isn't a thing I can help you with, or you should go to the hospital right now because you're actually having a medical emergency. Like, it's part of my job.
Yeah.
But I totally get why people are frustrated. And it's sort of the unfortunate catch-22 that if you want to use your insurance, because it appears that it might save you money, it might not actually in the end. But if you want to use your insurance, it might take 2 months until you can see somebody.
Yeah.
Right? Or if you want to see somebody today, you have to spend a little bit more. It has its pros and cons, and to each is their own. But that's why I don't take insurance in my practice. So I can see you today. We can spend the whole time that we need to get all the answers. I don't have to do what the insurance company is going to pay for. I do whatever I think is going to help you, and so it comes at a premium, like you said, but for a lot of people, I actually end up saving them money because what most medical doctors, like just general practitioners, get of musculoskeletal training is 2 weeks in medical school.
Dang.
That's what I get in 3 years, and then I did a
2
residency
weeks?
too. Yes.
Whoa.
It's because they have to learn all these systems, right?
Yeah.
So they do 4 years of med school, 2 years of classroom stuff, and then 2 years of like internships at the hospital. But they're covering every system.
Yeah.
So your reproductive system, endocrine system, cardiorespiratory system, things like that. Instead, I'm doing 3 years of just one system. So one of their blocks I'm doing for 3 years that they only get to do for 2 weeks, right?
Yeah.
So a lot of doctors are hip to this now, and they're just saying, hey, like, go see the physical therapist. They're a little bit more well-versed in it. But anyway, so sometimes it might seem like you're going to spend more money with me because you're like, oh, he doesn't take my insurance. He's got a premium. But instead, you go to the doctor, you have to pay your copay there. And then the doctor wants you to go to an x-ray, and you have a copay for the x-ray. And then because of that x-ray, then they want you to go see an orthopedic surgeon because they found something on the x-ray that's totally benign, but now they want to make sure they cover their ass, and they're having the orthopedic surgeon see it. So then you have to go see the orthopedic surgeon. That's another copay. And then you've spent 3 days where you might have had to call off work. You've had to drive and get gas. And then at the end of it, the ortho surgeon might say, oh, we think you should do surgery. It might not even be warranted. And then you might get an unnecessary surgery, or they might then say, okay, now you need to go see PT, and then you have another copay for your PT. Or you could have just seen me on day one, right? So there's like a trade where sometimes it might feel like, oh, well, I want to pay my insurance because my insurance, I'm just going to pay the copay and all that stuff. But in the end, you might actually be spending more money because, A, not only do you have to go through all these steps, but you might need more appointments. Because with me, like I said, we're going to spend the whole hour. It's just going to be me. There's no aids. I'm not going to put you on any machine. Unfortunately, the insurance company pays for those things even though it doesn't work. Yeah. So then you're going to go to the PT for 2 hours. They're going to put a hot pack, an electrical stim, ultrasound on you where the research shows it doesn't do anything. And you have to do more sessions, or you could just come one and done it.
There's a greater cost that I think people aren't taking into account for, and that is it's not just the financial cost, right? Which they don't see up front. Yeah. Like you said, there's a copay for this, there's a copay for this, and then there's a copay for this, and then all that stuff. But there's also a time cost that comes with that. But then there's also, people don't get that there's a level of threat or like discomfort that comes with it too. Because, okay, if I have to go see the doctor for this thing that I thought was this, then he goes, oh shit, well, I'm going to send you to this guy. Then that guy's like, I don't know what that is. Now my perceived threat starts to go up, and what started as, oh, I just have back pain, now it starts to elevate.
Totally.
And, I spoke with another pain management specialist several years ago, and we talked about how you could have asymptomatic injuries per se. I don't know if it was injuries exactly, but you have asymptomatic things on your MRI or whatever that is. That could have just been there, but it's not causing you any problems.
Correct.
But then you go from the doctor to the x-ray technician to the MRI technician, I don't know if that's what it is, and then all of a sudden they're like, oh man, you've got like all this stuff, but we don't even know if that's causing you any pain.
Correct.
And now I'm like, oh my God, what could have been super simple is now threat level 10.
Yeah.
And that comes with a cost. That increases your symptoms as well, doesn't it? Like we talked about the psychological aspect of pain. Now I'm like, oh man, I'm really messed up now. Yeah. And I think people need to understand that what you are experiencing, like, go see a specialist like yourself, whatever. Don't try to solve it yourself. Google it, because that's just going to be even worse too. I had that same experience a couple months ago where I thought I had appendicitis and I had just like lower right abdominal pain, but then all of a sudden I started Googling. I'm like, oh my God. Or you think that this social media influencer is going to be like, you think this mobility exercise is going to help you? Like, maybe it does, maybe, but I just think that's a stretch to say that maybe your symptoms improve, but was that really the cause?
Yes.
I don't know. I don't think so. And
this is why context matters.
Context matters immensely.
Yeah, because you like you said, you could have a benign finding on your MRI, right? Or you could have pain, and the orthopedic surgeon's like, you should get surgery. Yeah. But then when I'm sitting with you and talking, you go, it's actually not that big a deal. Or, hey, even though they found that on an MRI, that doesn't make sense with why you're having this pain. It's something else going on.
We both know somebody that happened to,
Correct.
right? Like,
Yes.
doctor goes, you have this thing. This is what it is. You see them,
Yeah.
and you go, hey, this is a simple facet joint irritation. Like, I could have taught a class about this.
Yeah.
But there's more credibility for some reason that gets, I don't know, given,
Yeah.
orthopedic surgeons are great. They've done amazing things.
Yeah.
Thankful that we have them. But I feel like we all need to work together to defer to one another when it might be outside our scope, or we might go like, hey, is it really necessary to do this surgery, or can we go to a physical therapist and get this remedied? And I think I would encourage people more so to take that approach.
Yeah, so I have a list of surgeries that I know if the patient does it sooner has better outcomes.
Okay.
It's not that many. And those things are usually like emergency stuff. So for instance, like a rotator cuff tear, like a big one on a younger patient, the sooner they get the surgery, the better off they're going to be.
Okay.
In other cases, the longer they wait, the better off they're going to be. So when I'm seeing somebody, the question is, hey, what's going on in this and that? And then if surgery is a possibility, I'm going to ask myself, is this something that if they get it sooner, they're going to have better outcomes? And if not, then oftentimes we should employ a sort of like, hey, let's try a more conservative approach, PT strengthening things, and see if you're satisfied with that. Because either you avoid an unnecessary surgery, or two, even you still get the surgery, you have better outcomes because you have more mobility, more muscle strength, more coordination. Now, if on the test I see that, hey, you have something and it is something that, getting surgery sooner is going to help you, I'm going to tell you. There's even some cases when people have, whenever somebody has low back pain with nerve stuff, one of the things that's coming into my mind is something called cauda equina syndrome, which is when a part of the spinal cord is getting compressed, that you start getting numbness or tingling in your groin area, or you have like urinary retention, meaning you're like trying to pee, you can't do it.
Interesting.
This is a medical emergency. If you don't get surgery within 48 hours, you might never have an erection again. Right? So in this case, I'm going to tell somebody, I'm going to take them to the hospital to get the procedure, right?
Yeah.
But if it's something else, like, hey, I have low back pain and the doctor says I have like a little bit of arthritis in my spine, there's no evidence that says that if you get this surgery sooner, you're going to have better outcomes. So in that case, even if they're like, hey, I really want to get the surgery, I'll say like, why don't we wait and see? Let's see if we can strengthen a bunch of stuff, get your mobility better. Because either you don't get the surgery, you're happy. So we didn't have to do all the scar tissue, the risk of anesthesia, the risk of infection, all the time off from the surgery. Or even if you do, because that's like the only option we have left, you're going to be much better off because you're stronger, you're more mobile, you're more coordinated. So your recovery from the surgery is going to be far better. So a lot of people, unfortunately, get unnecessary surgeries or they're too aggressive for the surgery. So my job is to say, is that even something that we should entertain? And if so, is it time sensitive? Like if you had a full thickness rotator cuff tear, I'd be like, hey, let's be more aggressive about the surgery, right? But if you had something else, like, again, some arthritis in your shoulder, I'd be like, why don't we wait and see? Because, again, it's not like there's some stuff that we need to take with urgency, and there's some stuff we can say, let's try everything we can first because you're better off with that. Unfortunately, PT is still a new career. Like, I think we just celebrated 100 years as a profession, so a lot has changed. Mm-hmm. And the other thing, too, is I think it's changing faster than the public knows what to expect of it, right? Because,
what do you mean by that?
So, for instance, 10, 12 years ago, the public couldn't come see us first. So some people still don't know that. They think they have to go to their doctor, right?
Okay.
Like our roles and responsibilities are changing so fast in the things that we know because it's still a career in its infancy. So the public is like, I don't really know what a physical therapist does, but they all know what a doctor does, like a medical doctor or a surgeon, right? So we still hold them to the highest regard, and in some cases they should be for certain things, right? Yeah. Like if someone's operating on me, I want it to be a surgeon. If somebody's going to tell me what medication to take, I want it to be an internal medicine doctor, right? But the public still doesn't really know what physical therapy has to offer, and I think some of them think it's just hot packs and ultrasound because that's what it was 15, 20 years ago. Yeah. And so that's kind of what I mean. Like the research is changing so quickly that the expectations of what we can provide as a profession aren't keeping up with what we can actually provide as a profession, right? People still think they need to go see the doctor so they get a physical therapy prescription, so they come and they get a hot pack with some ultrasound on it. And now I'm trying to tell them, no, come to me first so I can do an analysis and check your hip mobility and strength and all these things to play a part as to why you're having this pain, so you don't need to see the doctor to begin with.
Yeah.
And they're like, This is brand new to them. This is the first time I'm telling them. And then they go, oh, I'm still going to see the doctor. I'm like, okay. but that's just because they've had so many years of this mindset that I'm supposed to go see the doctor first. They're the one, and
Yeah.
you have to, there's an education component basically.
Yeah, that's really promising. I think that the field is evolving so rapidly, and now whatever it is, the insurance companies or the medical field, whatever, are starting to recognize that, hey, you can just go to a physical therapist and you can get treated and stuff. And now I think there will be a shift in the paradigm around pain and pain management for people where they can recognize, like, oh, I don't need to go see the doctor. I can do this and stuff. And I don't know, I would just encourage people who like feel these issues, please, for the love of God, don't go on Instagram and go, oh my goodness, like this mobility exercise is what is going to be the solution, which will take me into my next question. Is it always a matter of mobility?
No.
It's not always a matter of mobility.
Yeah.
Like,
so there's 4 things I look at. Right.
Okay.
I there's a really good mentor and teacher of mine, Skolpan of Ossipon, who came up with the FAST principle. So flexibility, activation, strength, and timing. So if we're dealing with somebody who has pain and it's because of the way they move, right? It can be a mobility issue. That's flexibility. I'm just going to interchange it, even though they're a little different.
Flexibility and mobility can be interchangeable.
For now,
Okay.
let's in this context.
Got
It's
it.
a little different, but is it a basically a range of motion issue, right? So you're having pain when you squat. If your ankles are stiff and then you have to round your back too much, it's a mobility issue, right? Like you don't have the mobility in your ankle and it's causing too much tension on your back. But that might not be the issue. You might have perfect mobility, but you don't have the right muscles turning on. You might be using your paraspinals to do the lift instead of your glutes. And it's not because you don't have the space to use your glutes. You're using your back muscles because that's what your back is used to doing, and you're not used to turning your glutes on, right? Then it could be a strength issue. You might be trying to put up 300 pounds on the bar, but your leg muscles and your glutes and your back really can only do about 280, and that last 20 is now just strain that's being put on your disc or ligament or whatever. And then there's a timing issue, meaning coordination. Like you might have the mobility, you might have the strength, you might have the right muscles turned on, you're just doing it with bad form, right? Like you're not hinging at the hips properly. You're just letting your back around, even though you don't need to. You have all the mobility to do it. So it isn't always a mobility issue. And again, that's part of where I come in to basically tease out, like, hey, is it a mobility issue or is it a activation and strength or timing issue?
I think it's flexibility,
Activation,
strengthening, and then timing. And timing, could you say, is
Coordination.
coordination? Exactly.
Yeah.
So between
Are you timing everything correctly?
Yeah.
Right? So, like, are you hinging at the hips and then your knees and keeping your back straight?
Yeah.
In the case of a squat.
And that doesn't have to pertain, or that doesn't have to be specifically for exercise itself. Like this could be happening because there's a coordination issue when you're, I don't know, walking or bending over, or something like that. And then, then we have the brain goes through that risk management process and goes, oh, hey, like I'm feeling a little symptom here, but that could just be because the timing is off, the strength is off, flexibility, etc. I think that's super helpful. I think that's really interesting because you go on Instagram and it's just all mobility.
Yeah.
It's like for some freaking reason, mobility is like the king of all solutions for pain management.
Yeah.
And I don't know where that came from.
Yeah, I think it was, you know why? Here's what it is. When somebody has a mobility problem, you can make those instant changes really quickly. So you know how we were talking earlier about how some people have an expectation, I'm going to go to physical therapy and that day, or the chiropractor that day is going to fix it.
Yes.
If they have a mobility problem, that could happen. So for instance, like as a PT, I don't think adjustments and manipulations are the end all be all. But some people will have neck pain because they have one segment that's locked. It's not that their spine's out of alignment, they just have a segment that's not moving. And if they turn to the left, for instance, and the left side, that segment doesn't move, it causes pain. I can adjust it or like do a little high velocity, low amplitude mobilization. And then that day their pain is gone because it was a mobility issue.
Yeah.
And I essentially did a quick stretch for them. It could be the same with you have a muscle spasm and then I stretch that muscle, the pain goes away because it's a mobility issue. So that's where I think it gets it feels like it's the king because it creates the fastest change.
Yeah.
But it only creates the fastest change if it is a mobility problem.
Okay.
If it's an activation or strength problem, then strength takes about 6 to 8 weeks. So people don't want to do that. They want the quick fix.
They want it now, yeah.
Right? So if it's truly a strength problem, doing more mobility is not going to help. You need to strengthen that muscle, and that's going to take 6 weeks. So it's not like the sexy soundbite of like, this one stretch will cure your back pain.
Yeah.
You know what I mean? And so again, it really goes down to having the expert decipher what is going on. Because if it is a mobility issue, we could potentially fix everything in one day.
Yeah.
Right? But it might not be the case, and that's where you need someone to look at it.
Yeah. And now the thing is, everybody's going, oh, kettlebell mobility. Like, you take a kettlebell and do these obscure movements with it and stretch, and it's going to solve your pain. And it's frustrating because I think you and I had talked about one time where that may work for some people. It may work because that is just for some reason what they needed.
Yeah.
And then, like, I found the solution. This is it. And then they'll shout it to the heavens and stuff.
Correct.
But I think the gist of what we can get at today is that context matters. Like,
Yeah.
I wanted to talk to you about core stability for spinal stability and reducing low back pain. But the thing is, I mean, just from us having this conversation today, that is context dependent. And it's
Correct.
heavily context dependent.
Yeah.
Maybe it does. Maybe that is what you need. But maybe it's not. Maybe it's something else, you know?
Yeah.
Flexibility, activation, strength, or coordination issue, timing.
I mean, I'll say this. Those are things you need. Like, you need core stability. Everybody needs it.
Yeah.
But the context is that what you, Cameron Harn, need at that moment in time, right?
Mhm.
Is that why you're experiencing your pain? Like, in my opinion, everyone should have good hip mobility. Everyone should have good core stability, good shoulder mobility, all those things, because if they want to be able to squat to pick up their kids or lift weights or swim or hike, those are building blocks for those activities.
Mm-hmm.
So from a biomechanical standpoint, yeah, you should have core stability. That's not up for debate. But the context matters. Is you not having core stability the reason you're having your pain? Or do you not have enough core stability? You understand what I'm saying?
Yeah, I know what you're saying.
There are some things that everyone should have.
Yeah.
But I think the issue is people, do they actually need that in that moment in time is the real question.
Okay.
Do they need more of it for what they want to accomplish? Are they even lacking it? You know, like, again, some people are like, they think they need to stretch more to reduce their pain when they're actually hypermobile, right?
Yeah.
So, like, everybody should have good mobility. They have too much. So stretching isn't going to fix them. It might actually make it worse.
Yeah.
So it's like, that's where the context matters.
Yeah, that seems to be a pretty common thing that people do. It's like, my back hurts, I'm going to bend over and touch my toes.
Yeah.
Or I need to stretch, I need to mobilize, whatever that is. And that may not be what is beneficial for you.
Correct.
It's hard to identify, am I hypermobile? Am I stiff? And that's where it's important to go to an expert. And to me, the investment means everything. Like, my investment in the premium that I pay to you is so significant because it allows me to continue to do what I love to do. And one of the other things about your approach that I really appreciate is you never have told me, hey, stop. Sure, there is a certain context when that would be necessary, but you try, and I think it's one of the psychological aspects of pain, is you try to get me to focus on something else.
Yeah.
Are you feeling that symptom? Can you get your glute activated a little bit more? Can you brace your core a little bit more? But that's also part of the process that you go through with somebody where you identify, is this a bracing issue? Is this a mobility issue? Is it one of these things that you talked about earlier?
Totally.
And yeah, I think it's incredibly valuable. And I would just encourage, again, for people to seek out, make that short-term investment, because you'll tell people, hey, I will see you 6 weeks, 6 months, or whatever from now, do these exercises.
Yeah.
And as long as they do them, for the most part, they're going to see a huge change.
Totally. I think about it like making a small change or like giving somebody knowledge can cascade a lot of really positive things moving forward. Right? Health can either be a vicious cycle or it can be positive momentum. Like, the vicious cycle is you have pain because that you didn't sleep well, and because you slept well, your pain receptors are even more, and then now you don't want to exercise, and because you don't want to exercise, you can't sleep again that night. So now you're sleeping even more poor, which makes you want to do poorer decisions. So you eat worse food, or you get in fights with people because you don't have the mental bandwidth. Now you're in a fight with somebody. You don't have the time to exercise. It just becomes a vicious cycle. Or it could be, I had a really good workout today. Because of that, I slept great. And the next day I have more energy, so that I'm making good decisions at work, good decisions with my partner. I feel more energized to take on different kinds of problems with more grace, and it keeps going forward and forward, and you're building a really good life. It's like financial investment, right?
Yeah.
You could just get into debt, and then because of that, you take a loan out with high interest, and you get into more debt and more debt and more debt, and it seems kind of surrounding. Or you can save a little money, put it here, and because of that, it's compounding like interest, and then next thing you know, you're good for retirement. You have a house. You can go on vacations. It's the same thing. Or it's like having a teacher that has said that one thing with you as a kid that's stuck, and because of that, your whole frame on life is totally different. I think when you seek an expert to help you, you really underestimate the value that a positive impact can have, especially on your health.
Yeah.
Right? Like your life could either be going in a vicious cycle, or it could be going in a positive momentum. So everyone has a different context, and I don't want to speak on what everybody should do for their life, but I really want to encourage people to find a good physical therapist that is in their area that they care about, and partner up with them, because it can save you so much headache and pain. And also, not even that, you just might be stronger, faster, more mobile, so that you can do all these amazing things you want in your life, all the things you love doing, longer and better. So.
Yeah. Well, dude, I think that's a great place for us to end. I could seriously keep talking about this stuff. Like,
I'm sure
I
we'll
wish
have
we
more
just had like
conversations.
3 hours
We'll make
just
it
to sit
happen.
down and do this, because there's so many other things. We talked about ice and stuff
Yeah,
before
we
when we
need
were
to
doing
talk about
treatment
that
and
too.
stuff. The inflammatory response too, where you said that inflammation in your body acts as like, if you sprain your ankle, it acts as like a internal splint, which that just blew my mind away. Like, because you think people go, oh, I sprained my ankle. Where's the Advil? I need to get the
Yeah.
inflammation down. But it's
Yeah.
like, that's your body protecting itself. Such a beautiful thing that has just evolved over time. Just
Yeah.
incredible. And I definitely want to go farther into those aspects of pain and how to help people further. And dude, I appreciate your time. Is there anything else that you want to say?
No, man, we have so much more to talk about. We'll definitely
Dude.
do one of these, and even
A couple
do it on.
weeks. We'll
Yeah,
do
yeah.
it again.
Yeah,
for
absolutely,
sure.
man.
All right,
Yeah.
man.
Well, thank
Appreciate
you for
you, bro.
everything. Appreciate you.
Thanks.